Coming up on today's show, we are giving you your weekly COVID-19 update and how it's affecting your mental health. Hello, darlings, and welcome to your weekly COVID-19 update. I am your host, Portia Scott, but I am not alone. I have two of my co-hosts joining us today. But before we get into that, let's take care of some of the housekeeping. So you guys, let me know where it is that you are watching from. Hello, darlings, as you guys enter the room. Mommy, thank you so much for joining. Thank you. Where are you watching from? We want to know where you're watching from. I know some of you guys are not staying home because some of the states are open, and we're going to talk about that as well. But if you are home, let us know where it is that you're watching from. As always, hi, Trisha, darling. Thank you so much for joining. As always, we want to know, what are you grateful for? We can always find something to be grateful for. So in the comments, let us know what it is that you're grateful for. Also, we want to make sure that we stay in touch with you and that you guys can stay in touch with us. And the way that we do that is to text the phrase "wake up" to 31996. That's "wake up" to 31996. You will be alerted when we drop a new podcast episode, when we go live on our daily show, and we're sending you some inspiration and empowerment throughout the day. One of the things that I want to make sure that we do is when me or one of my co-hosts says something that you enjoy, that you wanted to hear, that you needed to hear, we want you to type in hello darling in the comments. Also, if somebody in our community is saying something that you agree with, we want you to say hello darling in the comments. So you guys, thank you so much for joining. We're going to bring on my co-host. So the first co-host that we're going to bring on is Dr. Donovan Christie.
Hey.
Hi, Doc. How are you?
I'm back. Another week. We're in the 9th or the 10th week.
Yeah.
That. It's been fun.
It's been fun. Yeah. So what are you grateful for this week, Doc?
Well, it's funny you asked that, because this time, today I had a really good time with one of my youngest grandsons. He's been here. That's Donovan Jr. His son, his eldest son, is 18 months. And, when you get into that age, they just want to bang everything and move around, and, you can't even give them a good hug. So I made breakfast today, and he likes to eat. He's got that Christie trait, so he's an eater. So I was able to actually pick him up and held him for a good 15 minutes while he ate with me.
Aww.
So today I'm grateful for grandchildren, and as my wife said, God gave us grandkids because of all the hard times that we've had with our children. So this is our reward. So.
I completely agree. My parents would probably say the same thing. That's why they have grandchildren. So we're going to bring on our mental health professional, our next co-host, Martinez Sellers. Marty.
Hey, y'all. What's going on?
Marty.
How are you, Doc? How are you, Portia?
We're good. How are you?
Excellent. From Southern California. It's a great day out here.
Is it sunny?
Yes. Nice.
Right. It never rains in Southern California, right? That's what they say.
That's what they say. We do get some rain, but not as much as we need.
Absolutely. So, Marty, as always, what are you grateful for, my friend?
You know what? I am so grateful for you and Daryl in the background for helping me out this past Friday for my launch party. You guys hosting that for me. It was absolutely amazing. And we had such a great time, and just grateful for all the friends and families that kind of showed up and gave shout outs and all of that. And just grateful for just another day, y'all, to share mental health and to speak up, speak out and live, and to wake up and to show up.
Absolutely, absolutely. I love it. I love it. I love it. You guys, I'm just so grateful today. You know, it was funny. It was raining, but earlier today, it was just a beautiful day. And I'm just so grateful for just another day to enjoy my family, to enjoy my friends, to come on here and be able to do this show with you. We see Trisha's in the house. Deja, hello, darling. Thank you for joining. Paula, thank you so much for joining. Marty, you're getting some congratulations. Enjoyed your launch party. Teresa, hello, cousin. Thank you so much for joining, darling. So you guys, let us get in today's show. We have a lot to cover. Doc has a lot. Marty has a lot. A lot has been going on, and we want to find out what's going on. So, Doc, one of the things that we usually start with is to give us the numbers, but kind of give us some of the data that's going on right now with COVID-19.
Well, it's like anything else. If you wait long enough, things are going to improve, right? So we're seeing a lot of indicators that things are getting better. First, the number of new cases in the United States this week was 6,229. And thus far, we've had 1.6 million people diagnosed with it. The death toll, it didn't go it went up, obviously, but it didn't increase as much this 20th week of this pandemic as it did in past weeks. So we see a trend downwards in terms of the amount of deaths. We had 1,047 new deaths this week. If you remember weeks back, we were having 8 and 9 and 10,000 people. It was getting to that part. And now, so totally we have about 97,000 deaths. So that's a good thing. But what are the indicators that this thing is slowing down? I think if you look at the hospitalizations, because that's where most people are going to end up when they're very sick.
Mm-hmm.
You look at the people who are over 65, and they're going to have the highest hospitalization rate. And this week it dropped for them as well. The overall average of hospitalization is about 68 per 100,000 people. For the people over 65, it is 214 per 100,000 people. So you could see that from the average to being over 65, it's much more. Mm-hmm. And then if you're between 50 and 64, it's about 105. So about half of what it is after you hit 65. So this disease definitely affects seniors more so. We've been talking about this for weeks, but it certainly has been horrible for our geriatric populations. And then when you look at the death certificates, the amount of death certificate, we've last week it was at 18.5%. And now this week, that was week 19. This week it's 12%. So you can see that the trend, these are all indicators that things are getting better. The pandemic is slowly, I'm not saying this is going to happen next week, but it's indicating that things are definitely leveling, going on the downslope, and we should be thankful for that. Praise the Lord.
Right.
Absolutely. So one of the things, Doc, is, you kind of talk about we're on this downward trend. We're kind of seeing things slow down. We're still seeing the cases, but we do see we're on this downward trend. So ultimately, I guess, how will this pandemic end, or will it even end? Will it just get to a point to where the numbers are so low? What does that look like?
Yeah, that's a great question, because it will end. Whether we get another spike in the fall when flu season comes is still up in the air, but it's looking that it may happen. But there's 3 or 4 main things that you have to think about. What are the experts looking at when they're looking at the ending? When can we say we can go back to normal? And I think most people are predicting at least another year, 18 months. Some people even predict longer than that. Some people are predicting shorter than that. But I think if you look at the overall average, you're looking at least another 12 months. So what are the things that they're going to be looking for? First of all, let's look at the things that's worked. The social distancing. It's worked to curtail the number of cases. But as soon as we start to open up, you saw little blips, but not enough, right? Because I think the fact that most places were closed for at least 4 weeks. Some places longer, where people were home and shelter, and that had a big impact. But what did it do to the economy? What did it do for people who are sick and mental health? Mental health issues went off the chain, and Marty can talk more about that. But it's for churches, people not have that socialization that they've had in the past. So social distancing is good, but it has a lot of negative sequelas or complications from it. So we have to somehow start back. But how many deaths is tolerable is what we really have to think of as a population.
Right.
Do we shut everything down and just say, let the economy will go down, nobody will be doing this or that, or do we allow some things? Some people are suggesting strategically opening certain areas and closing down others. Let the biggest thing that's going to stop this pandemic, and you need to understand that, it's called herd immunity. Once you get the infection, and we know that 90 to 95% of people who get this infection will not die. There's good evidence now that says that because you have the antibody to the virus, that you will be immune. And based on that, that's why they're developing this vaccine. So herd immunity, if you are exposed to it and your body produce a good antibody to it, you're pretty much protected. And that's what you call herd immunity. That's why, you see a country, Sweden, and places like that, they just say, well, we'll just take the death from the people because, we know only about 5% of people are going to die. And then everybody will be immune because they would have gotten it. And that's one aspect. But the scientists are saying that 60 to 65% of the population are going to have to be infected with this disease so you can have herd immunity. When 65% of the population is immune, and then you'll see definitely the pandemic coming to an end. So, and then thirdly is the vaccine. If we get a vaccine, and we're looking at maybe getting a vaccine within 6 months, there's 3 different vaccines that are out there now. They're in trial, but they're still in stage 1 and stage 2 trial, and none of them are really said yes, this is going to work. But they know they know that this is a process. That's why they say 2 years. It doesn't, So we're rushing. We may give a vaccine, and then we find that yes, you mount some antibody, but you don't mount an antibody enough to kill it. But it will at least make the disease. If you get the disease, it'll make the disease less invasive. So those are the big 3 things. Social distancing, we have to continue in some extent, herd immunity, and the development of the vaccine. That's what's going to make this thing end.
So, Doc, a quick question. When we talk about herd immunity and that there needs to be about 60 to 65% of the population getting infected, do we think we'll reach that herd immunity prior to the vaccine? Or like just looking at the numbers now, do we think we'll kind of hit that even before the vaccine?
Yeah, and that depends on how soon we get an effective vaccine. Because I think if it takes greater than a year, we'll probably hit the herd immunity. But and if people stop, if social distancing rules are relaxed and people are now out there, like you see what's been happening, people have been doing things. They've been going to the beaches and doing all sorts of things. And so the more these restrictions are relaxed, is the more cases we're going to get. And we know that the people who are going to most likely perish from this are the seniors. So I would definitely tell the seniors not to go out, not to engage in any of these things, because they're the highest risk, 50 and above, really.
Yeah, or people who have like an immunosuppressive, like something like that. So those type of people, but pretty much everyone else. Yeah, I think, we've been having this conversation a lot, right, for 10 weeks. And I think, and now where we're talking about, at the beginning, I think about when we talk about the death rate and everything, and now we're kind of at the point to where we're like, okay, we know that some people are going to die, which still isn't a good thing, right? And so I wonder, Doc, when we talk about SARS, because what happened there when the pandemic, was it kind of herd immunity there too? Was it the vaccine? As you were talking, I was just thinking about some of these other pandemics that have happened. And was it just like, kind of the things that we're facing?
When you look at the numbers of SARS or MERS, I mean, they're like minute compared to what's going on with COVID-19.
Okay.
And the reason for that, once the cases were identified, they were so good at quarantining the positive people and identifying their contacts, and then quarantine those contacts. They were just very good at that. So the numbers didn't reach anything. But remember, when this thing came out, everybody was like, well, it's probably just going to pass, or they just didn't take it as seriously as they should have. And so that's why this thing was just able. Plus, it's more contagious than SARS, than MERS or the other SARS, because COVID is SARS as well, but it's just much more contagious. But yeah.
Absolutely. So, Doc, you actually mentioned, we're just talking about this, the delicate balance, right, between the population health and safety, the economy, how it has just, pummeled through our economy, and even with mental health. So, Marty, what are you seeing as it relates to just mental health? I know you have your regular clients. Are you seeing an uptick in people coming in due to coronavirus, things that have kind of prompted these anxieties or things like that? What are you kind of seeing in your practice?
Definitely, I think we're definitely seeing across the board, and even with a lot of my colleagues in this, increase, as Doc was saying, anxiety and depression, and especially those who already suffer with isolation issues, because again, and the term social distancing also it plays on our psyche a lot of times, because socialization, that's so important, that we still have to socialize. And I wish they had come up with the term of more physical distancing, because I think our minds interpret that better than social distancing, and too many people have even stopped socializing. And that's why I'm glad they made this big push that we have to stay in contact with our support as much as possible, in order that we may not plummet emotionally and psychologically in this hole, if you will. But definitely across the board, there has been definitely increases in anxiety, increase in depression. Those with PTSD, definitely that kicking in. And as I've said in the weeks before, I'm kind of terming this more of complicated anxiety and complicated grief, complicated PTSD, because of the several layers that go on along with this social/physical distancing has caused as well, because of just the very nature, like Doc is saying, the uncertainty of it. We've been overwhelmed with information. We don't know what's true. Sometimes we don't know what's bad. Then we have those in leadership not being in. Okay, this is just Marty in his own and ministries. Media is not responsible for the. But when we're having what appears to be some sabotage and social economic battles with this, it gets very disheartening, especially in our communities of color, when we are already skeptical about the mental health and physical health systems. And then we're seeing these jumps, as Doc is saying. So we have to address those things, and teaching our communities how to deal with this, and not to get caught up in this. Okay, now we're out of prison, if you will, or out of our mental prison, out of our psychological and our home prisons, and just run out there and not be careful. But we have to practice safe returning measures.
Absolutely. I love it. I know Paula said, she has a question. She said, how do you feel about President Trump labeling churches as essential and wanting them to be open immediately? Paula, I'll speak to this, and kind of leaving the politics out of it. I think everything that we're hearing here, Doc even said it last week, is just when you're going out, making sure you're safe, right? And wearing a mask. But that too is a personal thing, we would hope that people would wear masks and practice these physical distancing measures to take care of one another. Right. The mask is uncomfortable. It's hot for some people. I mean, but it's important that we take care of one another. And as it relates to church being essential, Doc even mentioned it. A lot of people rely on that community. A lot of people rely on that as their stability and their anchors and the people that are there. And so wanting to have that interaction with one another, I do believe that each pastor and like each state is going to do what they do. But I believe it is important that each pastor kind of does it on their, how they do it. I will speak for us at Christ Culture Church is that we have not opened up. And when we do open up, we are currently putting together a task force to do this effectively so that, yes, we want people to come back, but we want them to come back safely. So we're putting together a task force so that we have people that, like Doc, right, that will be able to tell us how do we do this effectively to make sure people are safe. One of the things we're going to do is rope off certain areas so that families sit together and then you have that 6 feet of distance. We're going to make sure that we have thermometers. We're going to make sure that for us, you will need to wear a mask when you come in because our pastor is immunosuppressive. And so if you don't have a mask, don't worry, we have one for you. We're going to have those protective measures in place. We're also going to have sign-ups so that we're actually extending and having extra services so that we can that people who want to come can come, but they can come safely within that, 10 people gathering together. So for us, I can only speak to the things that we are doing to ensure that our people can get the community that they need, but that we do it safely according with, the guidelines of the CDC and with medical professionals that we have within our church. So that is how we're doing it. And I would just hope that other people are doing it that way, that we're using wisdom. So to be able to reintegrate. So that's kind of. Oh, Dr.
It made me think I could see calling up the RSVP. Do you think I can come to church this week?
So no, we're actually right. Well, what we're going to do is have it online. We have the automated system.
Right, so you can have some people come some week and other people come the other week, staggered.
Well, more so it's going to be timing, right? So we'll have two services. So you can come to one or you can come to two. And so I trying to put those measures in place to make sure that we're doing this for your safety, and stuff like that. So one of the things, Doc, and Tricia, we're definitely going to get to your question, but Doc, I want to go back. I want to go back to hydroxychloroquine. Because at the beginning, hydroxychloroquine was the savior. If we were going to be saved by hydroxychloroquine, I mean, I was excited because we have some in the cabinet. If I wanted to take some, I could get it. But no, I'm just kidding. I'm just kidding. People. Don't think that we're not a doctor.
Atlanta.
Let's talk about why were chloroquine and hydroxychloroquine originally considered to be promising candidates, but now we're seeing some death rates in patients that have had the medication as a form of treatment.
Yeah, and and obviously President Trump tweeting about it and even last week saying he's taking it.
Both services.
I didn't hear that. What do you about both services?
Yes, Pastor said we need you at both services. He's just kidding.
Tell Pastor we heard him.
I can't sing with a mask though. I don't know if that's how that.
Well, no, but that's different, right? So you'll be uncovered, but everybody else will be covered. We'll figure out the logistics. But go ahead. So go ahead, Doc, about hydroxychloroquine.
Right. So hydroxychloroquine, Portia, has been around for a long, long time. Chloroquine and then the hydroxy form of it. Mm-hmm. It is an immunosuppressive drug because it's effective in is autoimmune disease, which is an overexcitation of the immune system where it starts to attack its own tissue. So you needed something that would suppress that immunological response. The bad thing about so it's good in lupus, rheumatoid arthritis, and it's actually excellent for malaria. So the problem with it is that what they've found, and they've tried it, they tried it when they had Ebola, it didn't work. They tried it for influenza, it didn't work. And so we tend to forget, okay, well, this didn't work for these other viruses, but here we are, and everybody jumped on the bandwagon, think it was going to be a game changer, but it's not, because it turned out that when they've analyzed it, is that it reduces the cytokine storm, but it suppresses the immune reaction that would help to fight viruses. So remember, the immune system is very complicated. You have all these cells and cytokines and leukokines and all the stuff working, and they're trying. You can't suppress one thing that's going to cause you to get cancer. Being on an immunosuppressive drug can make you do that because it's suppressing one particular part of the immune system. So that's what they found out. And everybody, they talk about the cardiac effect, of hydroxychloroquine with the heart rhythm, and how people with certain conditions, prolonged QT, can have an arrhythmia and then die from that. But that's rare. I think what we're really seeing, and that's why people, when they used it with people who are sick, they did not see a good result with it. Matter of fact, they thought that the death rate increased on hospitalized patients when they were put on it. So that's the part of it, and so now, does it really work for prophylaxis before you get it? We know, we can say affirmatively, it doesn't work while you have the disease, because those people got worse, right? So does it work for prophylaxis? And so there's still trials. There are trials going on right now. But initially, those early trials in France and in China showed that there were improvements, but as time goes on, the results are not panning out.
Absolutely. Absolutely. Thank you for that, Doc. We talked a lot about it in the beginning, so I wanted to make sure we went back with just some of the stuff that was going on. Marty, you kind of talked about, you were seeing an uptick in just the patients. And so just from a mental health standpoint and just the industry as a whole, what are you guys seeing around divorce rates and any statistics on even after this? Do you think that those will lower once people really figure out, like, okay, maybe it was the most, or higher when people realize that, maybe we've been in here too long and I really found out, and so we hope on the other end, it will be that it's lower. But what are some of the statistics or things that you guys are seeing in the mental health field as it relates to these families?
Yeah, that's a great question. And my marital referrals have definitely increased. And what we're doing is getting used to this new norm, if we can say it that way, of us being around each other this much. Remember, everyone was on the move in such a way that couples were moving, children were moving, and so we didn't get a chance to remember personalities and personality types and actually dealing with our children. So some of the things that we're definitely doing is helping our couples and helping our families with what I call effective communication during this crisis, and giving each other latitude to feel the anxiety of this, but also to communicate those feelings and not being offended. Part of the problem is men, we are fixers. And sometimes, one of the main things that the wives are saying, listen, I don't want you to fix it because you can't fix it. I just need you to hear me. And so trying to teach them, and then in turn teaching the parents to listen for understanding, and not necessarily to listen to fix, but listen. Sometimes we need to just release those emotions with it. And I think that's a problem that we as men a lot of times have, because we don't deal well with emotions, number one, and then we don't deal well with things that we can't fix or try and find some sort of resolution. So getting men and those personality types like that to understand some things you can't fix, and you just have to, quote unquote, like Doc said, we have to ride the wave of this and give a lot of gratitude and longitude in that, and creating our own normatives and ways of releasing a lot of the stress. And whether that's, Doc says it every week, physical activity, getting outside with the vitamin D, getting out there and doing something to break up those normatives.
Absolutely. I love that. I love how you said, really here, listening to listen and not to fix, especially with children, and not wanting to fix it, but just being heard. So we're definitely going to talk about getting out, because I got a question for you, Doc, but I have another question. So Trisha wants to know, can you explain vaccines and their benefit? I previously stopped getting the flu shot because I was getting sick. Now I would definitely get a COVID vaccine, and there is still so much information online about it positively and negatively. So Doc, let's talk vaccines.
Yeah, well, I mean, you have your vaccine advocates and you have people who would never vaccinate. Now, what I want you guys to know, all your listeners, is that rarely, you do have some live viruses that are injected, but usually it's an attenuated live form, and it's not supposed to actually cause an infection. With the flu virus, the influenza virus, that is a live vaccine. It's attenuated, and 99% of people will mount a response to it, and they'll be fine. They'll be protected. We have 97,000 deaths right now from COVID in 4 months. The flu typically causes between 20 and 40,000 deaths per year. And once again, in people who are immunocompromised, or people obviously who didn't get a flu shot and are immunocompromised, or the elderly. So, they do mandate. And the thing is, the virus itself, the flu virus, it's very smart. It changes every year. The flu shot you got last year is different than the flu shot you'd be getting this year, because the virus mutates. That means it changes. The genetic material will change, and it'll have a different expression on the outside of it, so it can attack our cells and get us sick. COVID-19, they don't know if this is going to happen. We know right now that there are several strains of it, right? There's 2 main strains, but I saw research a couple of weeks ago that there's 8 different strains, but there's 2 big ones that we know about. So whether or not getting the disease is going to give you lifelong immunity, we don't know that. But even if it just helps you for 6 months, a year, whatever, it's going to be better than not. But vaccines are relatively safe. I got all my childhood vaccines when I was younger. I had no choice. This is what we did until the big issue came about with autism, and they're blaming another live vaccine, which is MMR, as a culprit for that. And then you have people who don't want to get any vaccine, and they can get away with that because there is herd immunity. There's herd immunity in the population because everybody else has been vaccinated or had the disease. So they can get away with that. But we have seen increasing cases of measles, increasing cases of pertussis and the stuff like that we were normally vaccinated against. So I think that with this new COVID, I wouldn't be jumping on the bandwagon right away. I would make sure that, number one, the vaccine is effective before I would definitely do that. Some people they're more risk takers, so they'll even enroll as subjects to get the trial vaccine in its first stages, and you need people like that. But I think most people would be risk averse.
I love that, Doc. Thank you for that. That's just good anyway, because you answered the question that so many people have, right, about vaccines and are they safe, and especially with the flu, because like you said, it changes every year, and there's so many different strains, but if you get the flu, you're likely not to get it as bad. Good evening. Sorry I'm late. Question. If you have a light symptom like a scratchy throat, can you start preventative methods like gargling with warm water and salts as you would if you feel symptoms for a cold and you knock it out with fluids, tea, honey, etc.? Doc, is if you start to feel the symptoms, is there any preventative measures that we would take for like the common cold?
Well, you don't know if it's a common cold. So
Right.
definitely all the stuff that you're doing there, I would do it. I don't think it'll hurt it. Um, it depends on your health, how you're doing. Let's say it was COVID. Scratchy throat don't mean you have COVID. I mean, it could be
Mhm.
at your allergies. It could just be a regular virus. It could be a bacterial infection. You don't know that. But doing those things, I would tell you, continue to do that. Make sure we add taking vitamin D, taking vitamin C, your zinc, selenium, doing all of that. Elderberry. Some people get into the elderberry; they'll do that as well. Yeah, so none of that will hurt for sure, and it may make it better. I know some people they're putting steam because the virus apparently dies quickly under heat. So if you feel like you've been exposed, you could put lemon and lime and heat it up on in some hot water and get the steam and cover your head and let that steam run through you. I've seen that done, and being from the Caribbean, that's something that is routinely practiced. So that's another item because of the heat and the chemicals from the lime and so on that is beneficial.
Absolutely. So Marty said, Doc, we got to start getting out there. And we are definitely getting out there. And summer is approaching, and we're going to be headed to the pools we already see people at the beaches. I mean, forget
Same here.
physical distancing at the
Right.
beaches because you've seen that. So this is really around more so not even around the people, but about pool water, right? Chlorine is in pool water. Does it automatically kill the virus, or is there a time as in, you're affected, you get in the chlorine, does it kill it automatically, or is there a time period before the virus actually dies just in pool water?
Yeah, well, I think it depends on the strength of the chlorine. You've been into some pools where they put so much chlorine
Mm-hmm.
that your eyes are burning.
Mm-hmm.
And then you've been in some pools where you don't even know there's chlorine in it. But chlorine definitely will kill the virus. It's what's in bleach, and we know bleach. You shouldn't ingest it, but it does kill the virus. So, yeah. So I mean, I think at this point, I know that the biggest risk is from people coughing or sneezing or touching you with their hands. That's a bigger risk than being in a chlorinated water with hopefully not an overcrowded pool with a proper social distancing. I don't think it would be too bad because that the virus cannot do anything in that water.
Okay, that's perfect. And then what about beaches? Not chlorine, but
Salt.
what? Yeah. So is salsa?
Salt, yeah, nothing can really grow in that. It's so, well, it's not a bacteria, but salt water I would think would be pretty safe just as the chlorinated water.
Okay, perfect. I love
Yeah.
it.
Now I know
Marty,
out
were you going to
here,
say something?
yeah, I know in California they're definitely stressing with all of our beaches. Since I'm in Southern California, definitely suggesting putting on the masks out here. I know Memorial Day is a huge beach day out here, as they've slowly opened up the majority of the beaches. That we're stressing wearing the mask and still doing the social distancing. And one of the parks up in, I want to say it was in the San Francisco Bay Area, they were putting out circles, almost like little family circles for people to
Mm-hmm.
sit in. And I thought it was a brilliant idea. Since people we know are going to go to the park, let's put out circles so that we create the safe zones for the physical distancing. And it was great. It looked like the people were having a great time. They kept the people within those circles, and it created what appeared to be a great safe solution to this challenge that we're going to be facing for these summer months.
Yeah, I did see that. I think one of the things that COVID-19 has done is caused us to be even more, kind of tap into our creativity and
Mhm.
ingenuity. And what are
Yeah,
the ways that we can stay safe and still get out there and enjoy our families? I did see the circles. I loved it. They kind of had it so that you could
yeah.
practice in your area. So we know that chlorine kills it. It shouldn't be ingested, and that we want to go to the beaches. We're pretty safe with the salt water. And I'm
I think it's
sorry.
so funny that we have to clarify that. Do not ingest the
I'm
bleach.
sorry. But yeah, so I think we can have a good time, right? I've seen some CDC guidelines just around, like you said, Marty, wearing a mask still,
Yes.
physical distancing. Obviously, if you're in the water, you can take your mask off, not being in crowded pools, like you said, Doc, not sharing floaties and, life vest and all that stuff. So take your own stuff, making sure that you're safe. So I think there is some stuff around there. And so,
And
Doc,
there's a recent study that just showed that wearing a mask, well, they did this in mouse, right? Because they couldn't just infect humans like that, but they found that um, when they covered the mouse, when they covered them with a mask, and they were exposed to, they pretty much just blew the virus into their cell. It prevented them. The mask prevented 90% transmission. 90%. So yeah, masks. You may, some people complain about, well, they can't breathe, but when you're going out with a lot of other people around, it is a very wise thing to do. The supermarket,
Mhm.
the
wow.
when you're in your car, you don't have to wear it in your car. If you're the only one in your car, right? Unless
Right.
it's your family. But definitely, if you're going amongst people, wear your mask,
That's good.
because I don't see any patients without a mask.
Right, absolutely. So, Marty, I'm going to go to you and then I'm going to go over to Doc because they're kind of alike. So, Marty, one of the things as it relates to mental health,
Yeah.
what are some of the things that we should start doing as we're kind of transitioning back to work and, back to life? What are those, what are some of the things that you feel like you're going to start to see in mental health? You see this uptick. Do you think it will continue to be that way as people transition back, or will it
Most,
decrease? What are some of your ideas?
one of the things I think we're going to definitely see is once we get, I agree with Doc that we're going to be seeing um, the aftermath of this from anywhere from 1 to 2 years on the mental health profession. And that's kind of some of the buzz we're seeing because of child abuse that's not being reported, domestic violence that's not quite yet being reported in there. But I think we have to, not I think, we have to use wisdom in everything we do. So I've come up with this little acronym called TIPS. TIPS during the transition back into life. And T is for take your time. Take your time, do those things that's going to be comfortable for you in doing that. My mother is slowly getting back out there. And so she'll go out early in the morning, go to the bank and one of her favorite little mini grocery stores and come right back home. So as she slowly take your time. It's okay to still say, I'm not quite ready. That's fine. If you're not ready yet, take your time because that's going to help also in your mental health as well. The I was definitely for identify your mental health concerns and your mental health needs. Know what you need. Pay attention to your body. Pay attention to your anxiety levels. Even if you have to say, okay, on a scale of 1 to 10, where am I at today? I'm a 7. So in order to get me to a 6 or a 5, what do I need to do to get my anxiety levels back to its regular, normalized, regulated stance in that? So identify what your mental health concerns are during this period. The P is definitely for physical activities.
Mm,
Doc has stated that because it's going to help us with our immune system and everything as well. Walking, exercise, getting that vitamin D out, and doing it in a safe confines of maybe just your block or what have you, or in your house, walking up and down the stairs. Great cardio. in doing that. But definitely getting that physical activities, because it's going to get the blood circulating and moving, and it's a great releasing of those anxieties, and it's a great way of doing it that is low to no cost with that. That was the P, and the S, self-care. I am such a proponent of self-care. And when I say self-care, that is doing those things that you need to do so that you can optimize your life at its prime peak. If that means taking an extra shower, long baths, meditating, your prayer time, those things to help keep you grounded during this transition, because as we step down in these phases, there's going to be continued discussion about it. Self-care might even mean I'm not watching any social media, and I'm not going to turn on the television, because I need to regulate myself in that. So take all that self-care in there. So that's why I just want to offer to you my tips for doing this during this time. Tips during the transition back into what we might call a normal life.
I love it, Marty. I love it. So, Doc, we are going back into normal life, and you guys would know that I went out there. I went into the Target this week. I had to go to the kids' school. I had my mask on, and I did have I usually wear one glove, so I can have one free to touch my own stuff. And then when I take my glove off, Doc, you will be happy to know I go in and I don't touch my glove at all, and I wash my hands and I sanitize. So I went to a couple places. Aren't you proud, Doc? You're like looking like,
Yeah.
I talked about my struggle last week.
I've had,
We're supposed to
we haven't closed our office at all, not one single day. We've been out there. So, it's just wearing the proper protective equipment. And, if you know your normal immune system,
yes,
and I think you should be okay with that.
Yeah. And so, Marty, using your tips to get out there when I was ready, and how I was ready and how much I wanted to do was important for me. I'm not so worried, but I'm just always very cautious about John Henry. But while we're getting out there, Doc, let us know how many people have been tested in the US so far. What do those statistics look like? Do we still have a ton of tests to do? Are we on the right track?
Well, over 7 million, how many people we have in America?
A lot.
We have 400 million or so. So at this point, we have 7,362,000 people have been tested. Yeah, so it's really just a fraction of the people in the country that's been tested. And all the positive cases that we've had. 88,000. 975. 7.9% of the test results came back positive. So, it's we have quite a ways to go. But I will tell you, they are making the tests. These lab companies are making the tests more available to big labs, and I think they're missing the mark. Many primary care physicians should be doing the tests in their office, and they can't get them. We were lucky that we got 300 tests, and we were able to utilize, most of those. We tried to make another order just because over the last couple of weeks, it's just been going like wildfire, and people just wanting to come and know their status, which is what I've been pushing. And they're putting up barriers to giving it to the primary care docs, stating that they really wanted to go to a non-clear wave facility. We're clear wave as physicians, so we can do these rapid tests. But in terms of you having the machine to do the stuff where you put the blood and all that in there, or the nasal swab, those are more of the bigger labs that have that. So I think they're making a mistake by preventing us from doing the rapid tests, and that just came out this week from our supplier, saying that they were told that they now just need to sell to the big labs and not to the doctors. So I'm hoping I can get around that and continue the testing. But time will tell on that.
Wow.
Right. I know. I'm at a loss of words. So that was something new, Doc.
Yeah.
I'm glad I
Mhm.
went, early and was able
Yeah.
to get it thanks to you and your clinic. And that does, that makes it hard. One of the things that they keep saying that we can literally open all the states can open, which they're all opening, I think, at some portion, some phase. Everybody will be open, I believe, next week in some phase. However,
Mhm.
they're still not seeing, and we're seeing the beaches, so we think there's tons of people out there, but there are still tons of people that have not done anything to really establish and bring that economy up because they don't
Yeah.
feel safe still. And I think testing is one of those things. So I think along with opening the economy is testing, the availability of testing. Because if people know, even if it's just for our own, right, safety or
Mhm.
for our own mental health, to know that I'm safe and I'm going around people that are safe. Like there's a couple people in our church, right, that have gone to you that are safe. And so when you see them, you feel like, we're good. Granted, we probably have to test every couple of weeks, but it gives
Yeah, we had a little get together with a smaller group of people, but I will tell you that everybody there was tested because we had the ability. We had them all come and they got tested that week,
right.
and then we were able to socialize a little bit, because they were leaving, and so we wanted to make sure. But you're right. I mean, testing and knowing your status gives you a certain sense of security,
Yeah.
and we need to be increasing the access instead
Yeah.
of cutting it back. We were shocked, and then the price also doubled.
So then you make it hard, right, for somebody who is a frontline worker who actually needs this because they've continued to be out there. And so you make it harder for that person, right? Because when we look at people who are working the front lines, I'm not talking about medical staff per se, but I'm talking about the drivers. I'm talking about the grocery clerks. I'm talking about those people that are not making this large sum of money. And so when you charge them $60, $120 for a test, they'd rather not do it because they don't have it, right? When I have to make the decision between whether I buy groceries or get tested, groceries are going to win every time, or paying my light bill, or whatever it may be. So that's
Yeah,
something that's so important. I think
unfortunately.
one of the things that this pandemic has showed was capitalism,
Mm.
and how that it just changed the narrative, and it takes away from the, I guess, empathy of
Yeah.
those that have, and being so far away from that message. So it's easy to say, well, just give it
Yeah,
to the
you're
big
right,
lab.
because some people are looking at this as an opportunity to
Yes.
get rich.
Yeah,
And that's a sad part of it because, people are dying. I mean, almost 100,000 people have died so far,
right. And
and I
so,
know they want to,
Alarming.
the government did say that if anyone wants a test, if they can get a test, no insurance company will deny payment to the lab for those tests.
okay.
So, yeah.
But by the
Yeah,
same token, I think definitely let people know too, on the mental health side, listen, people are giving free to low cost services. Your insurances will do the telehealth now. That's so important to make sure that our people know that as well. And just get out there. Now's not the time to be suffer in silence due to shame, but get out there, ask, and see what services that you can get, because we have to make it through this. Look, what, as a commercial say, we're in this together, and we're here to support however we can to make sure that our people get help. We got
absolutely. So I know we have a couple minutes left. I do want to take any questions that you guys have. Thank you, as always, for sending in your questions, letting us know what you're doing. There's a couple of things that we're thinking about for the show. And because of that, one of the things that we're asking you to do is take our survey. It takes less than a minute to take our survey. And we're asking you, give us your feedback about this show. How has this impacted you? As well as, what are some of the things that you want to talk about, that you want to hear? What are some of the health things that are going on that you want to hear from a health perspective, and also from a mental health perspective? perspective. So send in your questions, give us your feedback so that we can curate a show that works for you. We are here for you. We want to make sure that we are bringing the best content, especially as it relates to COVID-19, but really your health and your wellness. We want to be your point people to come to for your mental health, for your health and wellness. And so the way that we do that is that we get your feedback. So thank you guys so much. If you guys have any questions, please let us know. Marty, I do want to ask, I cannot leave today without mentioning that May is Mental Health Awareness Month. Let us know, what is the mission of really Mental Health Awareness Month, and kind of how that came about and what can we do?
Yes, the purpose of it is to bring light to mental health, really on a national level, especially to communities who don't normally talk about mental health. And that's one of my passions, is talking to us about mental health and how we can, for lack of a better phrase, normalize it. That, listen, is not just a rich white man's disease or that type of thing. I say this all the time, Portia, as you know, mental health is an equal employment opportunist. It does not care about your sex, your race, your money, your economic, social status, or anything. Listen, when it attacks us, it attacks us. And we have to just learn to speak up about it. So the purpose is that we have these conversations about mental health and let you know it's okay that you go through mental health challenges. We all do at some point in time. And it's about helping you navigate through those challenges so that you can be empowered and equipped should you need those times and those services. And it's okay.
Absolutely. Absolutely. Thank you so much for that, Marty. So one of the things we want to make sure, we're going to bring everybody back and make sure that you guys don't have any questions for Doc or for Marty as we begin to wind down today. Today was such a great show. I mean, we had some great dialogue. We also got some great information. So you guys can go to the pool. We want to make sure that we're acting responsibly when we're there. The beach is also a safe place. Make sure that you're physically distancing, wearing your mask. You know, your mask doesn't just help you, but it helps someone else. And just think about the fact that you would want someone to care for your elderly grandmother, your elderly parents, or somebody that you had, that you love, that was immunocompromised. And all the times people don't look immunocompromised. So you can't tell who those people are. So we just want to make sure that we're doing our part. Thank you guys so much for joining. Doc, any last words for us?
Well, the only thing I wanted to mention that I didn't get a chance to is that, you know, the CDC came out with guidelines a couple of weeks ago for opening daycare centers and bars and all of this other stuff. And you know, the official things that came out was much watered down because the recommendations were kind of canceled and thought too stringent by the White House. So they have kind of left it up now to the local and state government to decide what are these things that they're going to do, you know, especially with daycares. But that's what's going on. And so, you know, as the country goes back to work, daycares are very important. Schools are very important. And it's important that we are definitely doing the things to protect our children.
Yes, definitely. I agree with you, Doc, with that. And we do that and make sure that we're equally having those conversations with our daycare providers so that they also know and giving the families the necessary information to make them feel safe and at home as well. So that's very true as we do that and make that transition, that we use wisdom and then make sure we're following those tips that I recommended earlier with that. So it's really great and we appreciate that. And hey, use safety and care in all that we do with that for sure.
Yeah. So I think at this point, Portia's probably had to leave for a minute. So I just wanted, if anyone else had any additional questions, we would answer it. Otherwise, our time is up. And it's been a pleasure working with Portia and Marty over these last 10 weeks or so. And we will continue it at least until we get some real direction in terms of where this pandemic is going and when the country can get back to work. So that's what my office number right there. I'm an integrative medicine, internal medicine pediatric doctor. So we kind of do everything there. My staff are all family medicine trained. And so we take care of the entire family.
And as always, we thank you for joining us for the weekly COVID update. You can find me at marcelconsulting.com if you have any questions about mental health concerns. Again, and also on my podcast with Mental Health Matters with Marty. You can find that all right there on all your podcast outlets with that, social media outlets with that. And again, thank you so much for joining us for the Portia Scott weekly COVID-19 updates. And you can join her every morning, Monday through Friday at 12 noon for her weekly show on the Wake Up and Show Up show with that. Until next week, thank you so much, and we'll see you then. Take care.
Yeah.